More than 4,000 people worldwide have died from Ebola, only one of those in the United States so far.
And with the recent diagnosis of the nurse who cared for the Liberian man who died in Texas, hospitals across the country are preparing should they be faced with the same case. WENY's Leanne DeRosa has a story. Leanne?
John and Jennifer, Ebola has become a growing concern for people all across the U.S. Now local hospitals, including Guthrie's Robert Packer Hospital in Sayre, says it's prepared should a case make its way to the Twin Tiers. With more and more cases of Ebola showing up across the United States, the CDC has released tips for screening and caring for patients with symptoms. Now Robert Packer Hospital is adjusting their practices to help identify a patient at risk.
Well, it's difficult to diagnose Ebola just based on symptoms, because the symptoms are, can be very general. Just high fever and headaches and GI symptoms can mimic a lot of other diseases. That's why we've got to really combine it with the exposure history.
So they've altered their electronic medical record and built in a few more screening questions. When a patient comes in, they'll be asked if they've had any Ebola symptoms and if they've been exposed to a high-risk area or other person who might have Ebola. If they answer yes, they're put in isolation. Hospital rooms just like this one, or really any private room within the hospital, can be turned into isolation rooms. Because it's not an airborne disease and can only be spread through bodily fluids, the hospital says healthcare providers just need to strictly follow necessary precautions by washing hands, putting on face masks, gloves, a gown, and eye protection, and then properly and carefully taking them off to keep themselves safe and stop the spread. They're confident the hospital staff is prepared.
But the thing about Ebola is that the type of isolation procedures or precautions that we take are the same as a lot of other severe infectious diseases. So our staff are very familiar with practices and protocols that need to be carried out if a high-risk patient should be identified.
Filippo says the likelihood of having a widespread Ebola epidemic in the U.S. is pretty low. He says there is just as big of a concern about a flu epidemic, which the CDC commonly quotes kills about 37,000 people per season. He says this means the hospital needs to be as vigilant about vaccinating patients for the flu as they are about screening patients for Ebola. Reporting in the studio, Leanne DeRosa, WENY News.